Good morning, Mrs. Lee. I'm candidate 417. Today I'll be performing the exam on you, okay? First thing we're going to do is biomicroscopy. This test, we're checking to see the interior structures of the eye, okay? So first, I'm going to have you put your chin and forehead behind the slit lamp. This has been cleaned during the overview time, and the slit lamp has been focused with a focusing rod during the overview time as well. The instruments that we've been using today were also cleaned at the time. I'm going to turn off the lights on the back of my hand. Are you comfortable there, or would you need to be adjusted a little bit?
Yeah, just move it
A little bit what?
Yeah.
Okay.
And go down a bit.
Okay. Can you just look straight for me? Good. Now close your eyes. First, I'm going to turn on the instrument. I'm going to diffuse beam at 14. A low mag. I'm going to check the left eye. I'm going to focus on the lids. Proctor view. Perfect. I'm going to be examining the upper lids and lashes. Checking the upper lids right now as I scan from temporal to medial. A little bit of pigment there, that's okay. Let's scan. Keep on scanning. No lumps, no bumps, no skin tags. I'm checking the lashes. They're full. No debris, no flakes. Now you can open your eyes. Now I'm going to check the inferior lids and lashes. I go from medial to temporal. Notice that there's a little bit of pigment there on the lower lid. It's okay. See, the lashes are full, long, and healthy. No flakes. Now I'm going to check the inferior palpebral conch. I'm going to pull down your lids, okay? I'm checking for any follicles or any papillae. As I scan, I see a little bit of papillae, which is fine. And then I go to the inferior punctum as I push the inferior punctum to check if it's regurgitating. This is open. And now I'm going to check the superior lid margins. I'm checking here real quick. Checking the lid margins. They are clean, clear, a little bit of capping, but that's okay. This next part is a little uncomfortable. I'm going to invert your lid, okay? I'm going to have you look down for me. Okay, now I'm going to check the superior palpebral conch. As I scan from temporal to medial, see there's a little bit of papillae, which is okay. No follicles, no lesions, okay? So now you can blink for me. Next, I'm going to check the superior bulbar conch. I'm gonna have you look down, okay? As I lift the lid, checking the superior portion. I'm scanning the superior portion. Checking for, there's a little bit of injection, a +1, the sclera is white. You can also see axon-fell loop there, or pink. Now I'm gonna have you look to your left. So look at the nasal bulbar conjunctiva, a bit of injection there, the sclera is white. I'm gonna have you look to your nose, or to your left, or to your right. Checking the temporal bulbar conch, injection +1, the sclera is white. I'll pull on the lower lid, have you look up for me. I'm checking the inferior bulbar conch. You see that there is a little bit of injection +1, and that the sclera is white. Next, I'm going to be evaluating the cornea. So here I'm going to have you always looking straight. I'm going to go into a higher mag. I'm going to a parallel pipette. Okay, starting from the temporal side, I'm going to do a scan of the cornea. I'm going to do a quick scan here. Looking for opacities, which I do not see any. Now I'm going to do an optic section. You can see from left to right, you see the epithelium, the stroma, the endothelium. And I'm doing a little scan to check for any opacities, which I do not see. Now I'm going to check the temporal Van Herrick angle. Okay. Optic section. As I do that, you can see that the beam is about maybe a 0 or grade 1, and that's pretty narrow angle. So now I'm going to go to a conical beam and check the Van Herrick, the interior chamber, for any cells and flares. As I go scan inferior to superior, there's no cells and flare. It's deep and quiet. Next, we're going to check the iris. So I'm going back to a widened parallel pipette. I scan from temporal to medial. You see the crypts and furrows, the pupil reacting to the light. And then now I'm going to go down to narrower beam to check for any transillumination defects, which I do not see any. Okay. The next procedure we're going to do is tonography. I'm going to have you sit back for a second. This test, we're just checking to see the pressure in your eye. This test is a screening test for glaucoma. Okay? So what I'm going to do is I'm going to put an anesthetic in your eye. Are you allergic to proparacaine by any chance?
Guess not.
Okay. So I'm going to have you lean back for me. And this time I'm going to put it into your left eye. We're going to sting on installation. Here's a little thing. Now I'm going to put some fluorescein into your eye. Okay. You're going to blink, blink, blink. Now I'm going to check the corneal, the tear film. I'm going to open to a wide beam. Diffuse, checking the tear film. You can see that blink, blink, that's spreading. And you see the lacrimal lake on the bottom there. Okay. So now I'm going to make sure it's widened. I'm going to take this back. Going to put down the probe that has been cleaned, that I mentioned already. Set it to 10 millimeters of mercury. And then I'm going to have you open your eyes and look straight for me. I'm going to raise your lid. Just look straight. Good. Now I'm going to applanate. The eyes are aligned, centered, and overlapping. I'm going to take it out. The pressure reading is 21 at this time. Okay. This pressure reading is a little high. 21 is an indicator that you have a slight higher risk of possibly having glaucoma. Okay. And there are further testing we can do for that. So I'm going to have you stay into the slit lamp so I can check your tear film. I check the tear film. Blink, blink. No stamping, no epi defects. Good. So now I'm going to have you sit back for a second. The next test we're going to do is gonioscopy. This test, we're just checking the drainage in your eye. Okay? So what I'm going to do is I'm going to have you just sit your chin here again. And I'm first going to check the corneal integrity of your eye. I'm going to check the corneal integrity of your eye. There's no epi defect. The epithelium is intact. No injection. Okay, so I'm going to have you sit back.
Okay.
I'm switching. So now I'm going to put some anesthetic into the right eye, okay? So it might sting again. I gave you a napkin earlier. And now I'm going to put in some saline whisk. I'll have you get back into the slit lamp. Going to make this go a little bit lower so I have some room to move up and down. Make sure you're centered. You okay?
Mm-hmm.
I'm gonna have you look. First, you're gonna look down. You're gonna look up. You're gonna look straight for me. Good. Now we're gonna move the higher mag. Most posterior structure I can see. So as I scan is trabecular meshwork. I'm gonna make my first rotation. This is the inferior quadrant. Iris approaches flat. Now we're gonna be looking at the temporal. Most posterior structure I can see here. As I scan up and down is Schwabe's line. The iris approaches flat. Is the pressure okay?
Mm-hmm.
I'm going to do one more rotation. Now I'm going to look at the superior quadrant. As I scan, the most posterior structure I can see here is Schwabe's line again. The iris approaches flat. Now I'm going to do my last rotation. Okay, most posterior structure I can see here. Oh. Most posterior structure I can see here is Schwabe's line. The iris approaches flat. I'll have you look up towards your nose and blink. Good. Okay, now I'm going to check the cord. Nope, way back. I'm going to check the corneal integrity of the eye. No epi defects, and it is epithelium is still intact. Now you can sit back. All right. So my findings for gonioscopy is that your eyes are a bit narrower, so there is a higher risk of increased eye pressure due to the narrow angles. Okay?
Mm-hmm.
But there will be further testing to figure out everything else. Good.